So good evening, everyone, and welcome to our Healthy Brain presentation. I'm Joanne Bracken, the CEO for the Alzheimer Society of Saskatchewan, and it's my pleasure to welcome you this evening. On behalf of the Alzheimer Society, thank you for joining us tonight. We had over 500 people sign up for this presentation, and we have about 160 people signed in to this event. So clearly, brain health is a topic of interest across Saskatchewan. Increasing awareness about dementia and helping people to understand ways to lower their risk of developing dementia is a priority for the Alzheimer's Society of Saskatchewan. There's now strong evidence through research that up to 40% of all dementias can be prevented. Helping people to understand brain health and the evidence-based strategies to lower their risk is part of our strategy. Based on our recent omnibus survey across Saskatchewan, we know we have some work to do to accomplish this priority. In November of 2021, the Alzheimer's Society was part of a monthly omnibus poll to evaluate public awareness of the warning signs of dementia, understanding of brain health, and the strategies to lower the risk of developing dementia. The results indicated that on an unaided basis, most of our respondents associate Alzheimer's disease and other types of dementia with memory loss. However, naming the other signs or symptoms is far less frequent. And in general, people are only able to list 2 or 3 of the 10 warning signs. We also found that awareness of preventative measures is very weak. Just under 1/3 of the survey respondents were able to correctly name one evidence-based strategy to lower their risk. And even when provided a list of the correct responses, 1 in 5 were still unsure of what they could do to lower their risk of developing dementia. To help increase awareness about lowering your risk and to provide you with some evidence-based information, it's our pleasure to host our Healthy Brain presentation tonight with Dr. Larry Chambers. This evening, the Alzheimer's Society will be giving away 3 copies of Dr. Chambers' book. So following the presentation, if you're one of the winners, you'll be notified and the books will be mailed out. Before I introduce Dr. Chambers, I just have a few protocols that I would like to go over with you. For tonight's presentation, all participants on the webinar are automatically muted. Your video and names are not shown to presenters or to other program participants in the webinar format. There will be a 20-minute question period following Dr. Chambers' presentation. Please hold your questions until the end of the presentation. We'll do our best to answer as many questions as possible during the time allotted, and only questions relevant to tonight's presentation will be addressed. During his presentation, Dr. Chambers will pose 2 questions that he would like you to post your responses to using the chat box function that on most platforms you can find at the bottom of your screen. I encourage you to set your chat box message to be viewed by everyone so you can see other participant responses. Tonight's presentation is being recorded. It's now my pleasure to introduce our keynote speaker, Dr. Larry Chambers. Dr. Larry Chambers is the Research Director for the Niagara Regional Campus at the Michael G. DeGroote School of Medicine at McMaster University. He is also the former scientific advisor to the Alzheimer's Society of Canada and co-author of the new book, Increase Your Brainability and Reduce Your Risk of Dementia. The book is based on research from the Optimal Aging Program and contains practical, evidence-based advice to help manage the major risks of dementia. Tonight, Dr. Chambers will speak to the widespread confusion that exists between normal aging and dementia, the relationship between dementia and Alzheimer's disease, and how some causes of dementia can be prevented or possibly reversed. There is strong evidence, first, that the brain is plastic, not static, and can improve at any age. Second, that action can be taken by both individuals and society to reduce the risk of dementia. Dr. Chambers will also discuss why public awareness and understanding of dementia should be at the same level of importance as other health considerations, such as prenatal care and cancer prevention. I'll turn it over to you, Dr. Chambers.
Thank you, Joanne. Very pleased to be here in Saskatchewan this evening. Could I have my slides now, Deneen? Good. So this is the book that we're going to talk about, and there's my name, etc., and the book name. And the next slide. And that's the picture of the book. Next slide. So the key messages in our new book are, as Joanne's alluded to, it's the first book for either professionals or the public that summarizes medical evidence that dementia can be prevented or delayed. The largest readership is the public, but a plain language summary of most of the up-to-date science with references is included in the book for people who want to know more. Because negative ageist thinking reduces the motivation of people to take action, the book also summarizes evidence that the ability of the brain can be increased at any age. The rate of loss of brain function in normal aging has been overestimated because of tests used. Example, speed tests are biased and therefore decline in intellectual function has been overemphasized. And doctors educated before 2000 mostly were taught that the brain could not develop after childhood, whereas we now know it can develop new circuits at any age. 3 steps you can take are keep your brain tissue healthy, keep the blood flowing in your brain, stay engaged and purposeful, and sources of support to prevent each cause of dementia is summarized in the book and includes what as an individual you can do, what your friends and family can do, resources available in your community, and last but not least, in the health service. Dementia is not the result of normal accelerated aging. Only a proportion of dementia is caused by Alzheimer's disease. Next slide. So the number of people aged 80 and over will double in the next decade. This is often described as a tidal wave, or about which nothing can be done because it is due to aging. But this is false. We now understand the science of what is happening to us as we live longer. And we're really keen to hear the news about the proportion of people in older age groups from the Canada Census, which apparently is going to, the 2021 census, which is apparently going to be available April 9th, almost a couple of weeks from now. Next slide. We expect it to be higher than ever before, the older adult population. So living longer better involves 4 processes to change. Change your view of aging, loss of fitness, disease, and negative thinking. Next slide. So with regards to health span and dependency, these 2 bars indicate the length, your typical length of your life, and what's happening now in communities and maybe in your situation, that maybe you're going to have the duration of multimorbidity and high dependency is going to be longer than maybe in the future when we expand the health span and reduce that time of dependency on the lower bar. So this is a very fundamental concept about our talk tonight, and that's that we think that the need for social care and other kinds of support at the end of life can be greatly diminished if we do the things we're talking about in the book. Next slide. Next slide, please. So here's the bars again, and this time we're showing that your birthday is along the top, and then you die at the end, and then you have hospital admissions through the top slide. These are the red arrows going upwards, and then there's this length of time we're at home and how much time we're in care is the previous slide. And then, of course, what we want to do is on the lower bar have fewer hospitalizations and be at home longer. Stay down to 6 days as opposed to 3 months or something, or a year or 2 years. The aim is to reduce the need for health and social care, to have greater resilience so the acute care is less likely to be needed when a challenge occurs. For example, a chest infection. So one of the ways we talk about it and think about it is that what you're doing this decade is going to have a big effect on what your life's going to be in the next decade. So if you're in your 70s now, you should be doing all the things we're saying tonight if you're going to be doing well in your 80s. That's another way to think about this. Next slide. So the second process is this loss of fitness. We now have really good scientific evidence and understanding that what is happening as we live longer, which is assumed to be downhill all the way due to the aging process, which of course isn't the case. We do have a turning point within our abilities. But the challenge is, what's the best possible rate of decline as we age? Next slide. So we call this two slopes going downward after the turning point as the fitness gap. So the narrowing of this fitness gap can be as a result of training. Next slide. So here it is again. This time we're talking about, say, the onset of heart failure fair ways down the person's life. They already have a fitness gap if they haven't done the things that we're talking about in this book. And the upper slope of the line, the line that's above the other line, is the best possible rate of decline. And the rate of decline after heart failure is what we want to try to avoid. And that horizontal line is the line we're just put in there as one of the things can happen, which is to change the amount of time it takes to get to the toilet. And this, of course, can be something that could trigger social care. Next slide. So this is the other way to think about this, that lower line is declining, but we start closing the fitness gap, we call it, by starting to take action in terms of physical and cognitive and emotional health. Next slide. So the fourth process is ageism, the process of negative thinking, a culture that is pessimistic and negative based on the assumption that everything is due to aging, which cannot be influenced, but there is a strong evidence that we can influence the other three processes. This is an interesting report that WHO just published a few months ago. And I always think of this issue as one of, are we talking about the glass half empty or half full? As we see, we do have some decline in some of our functions over time, but it's our attitude that really affects whether we're going to take the full advantage of our capacity. Next slide. So aging, the loss of fitness, negative thinking, and disease are all connected. Next slide. Now, the four aims of living longer better are that we understand aging, we regain the fitness of our physical, cognitive, and emotional health, we prevent and tackle disease, and we think positively. Next slide. So I want to just pause for 2 minutes, and if you could write in the chat box, what do you think we can do to increase our brainability and to reduce and our risk of dementia? If you just put in some ideas, Joanne is going to summarize those, but I'll give you 2 minutes to do that starting now. 1 minute is up. One more minute. Well, I guess I could stop the talk because you guys have all the right answers. But Joanne, did you want to mention a couple?
Sure. Lots of really great responses. Many comments about exercise, staying active, socialization, not smoking, eating well, good nutrition, staying engaged, less alcohol, reading, reducing stress, playing games and puzzles, enjoying the outdoors, challenging our brain, learning a new language, optimism, spiritual prayer or a faith life, and the importance of social connections.
Thank you very much. Could we have the next slide, please? So I'm going to give you my answers. But first, I want to talk about the relationship between dementia, Alzheimer's disease, and vascular dementia. So this Venn diagram, technically termed Venn diagram, shows dementia as the big concept, and then we have Alzheimer's within it. The other big type of condition within dementia is vascular dementia, and you see these two conditions, Alzheimer's disease and vascular dementia, overlap. And then we have this other anomaly where people with evidence of Alzheimer's disease sometimes have no symptoms. This is what the nun study showed, where 800 nuns donated their brains to be looked at after they passed away. And some of them had a lot of disease, but many of those people didn't have any symptoms. So this is really important to remember. Dementia is the bigger concept, and that vascular dementia is really big in this whole process. Next slide. So the way that we need to promote what dementia is throughout our community so that we are better able to respond to it is to think about these four things. When any of these things become problematic with you or your friends or relatives, a red light should go on. So the first one is if you're having trouble with your financial affairs, if you're having trouble with self-care and personal hygiene, if you're having trouble cleaning and maintaining a living space, and if you have trouble driving, which of course is a challenging one. Notice there's nothing in here about memory or genetics. These are not issues around functioning, and we have a whole industry of neuropsychologists that test us for almost everything, but the public doesn't need to know that. The public needs to know, here are the four things. If you're a blank teller, or if you're selling cars, or if you're a personal support worker in a home, or if you're renting space to an older person, these are the things you need to think about and know about. Next slide. So our book talks about three important strategies to reduce dementia. Keeping your brain tissue healthy, improving the blood supply to your brain, increasing engagement with other people. Next slide. And they're all related. So the first one is predicting the brain tissue. Next slide. So the four things to think about with brain tissue is getting more active and improving your physical fitness. We talk about that as the miracle cure. There's a big report that was published in the UK, United Kingdom, a few years ago, which it's extremely important to be physically fit for all types of health and disorders to be reduced in their risk. Reducing the impact of stress, sleeping better, and being wary of over medication, and this technical jargon term polypharmacy, taking multiple medications and drugs. Next slide. So this is an interesting cartoon for a happy 70th. The first page says, thought of sending you new slippers or a woolly cardi or a comfy elector chair, but I changed my mind. Next slide. I love you too much. So here's the best present, a resistance band to use every day. Here's some exercise to increase your strength and subtleness. Next slide. So the miracle cure, there are 3 things to think about: flexibility activities, strength activities, and endurance activities. And if you have any questions about this, you can always consult with your family physician, but generally how much you do, the benefits you receive from this, and these different types of exercises that are listed here should be on your agenda every day. Say 30 minutes anyway. Next slide. And then forest bathing or other ways to keep stress under control. This is really, really important. You manage your time, you make lists of what you need to do. Don't fall to misinformation. Prioritize regular exercise. I do that in going to work, and when I'm at home, I make sure I get outside in the afternoon. Take deep breaths, soothing breaths when you are under stress, and use simple behavior modification techniques to build resistance. These are some of the things you can do. And we talk about that in the book, or if you can also get information in the community about this. Next slide. So sleeping pills should not be your first solution to sleep. This is another important thing we have to be concerned about. We have amazing amount of new evidence about the importance of sleep, and it's really important to avoid caffeine, for example, not smoke before bedtime. And again, surprise, surprise, physical activity comes up again, but not just before bedtime. And I've been using a continuous airway positive pressure device for the last 7 years. And I'll tell you, I sleep better than I ever have. And there's all kinds of fantastic evidence showing that it reduces cardiovascular risk, and including dementia. Next slide. Now, this next one is about Betty, who was found by the CBC in Alberta by an investigative reporter. And she was a victim of polypharmacy and the side effects of multiple drugs. So she had an antibiotic for an ear infection, another one for painful swollen legs. She had been given prednisolone, 3 weeks given, another 3 weeks were given for another drug for ear pain, ibuprofen, etc. The doctor told her she was confused because she acted differently. She was administered a cognitive test. She failed, and despite her hearing problems and feeling sick. And then she was declared incompetent, and most devastating of it all, she lost her driver's license. So Betty was furious and Googled some drug names that she'd been taking and diagnosed her own problem. Went to another family doc, and he agreed with her that her symptoms were from drug reactions. And after 10 days without drugs, she was fine. And then she went and had her driver's test again and got her license back. She was 86. Next slide. Next slide. So keeping the arteries open. So this is an amazing slide when you think about it. There are 400 miles of blood vessels in your brain covering a surface the size of a tennis court. When you cut the vessels and spread them out, that's the size of it. So it's mind-boggling. That's every brain is like that. It comprises 2.5% of the body's weight. It receives 15% of the blood flow from the heart. and use 25% of the body's total oxygen consumption. Any reduction or interruption of flow can cause strokes or mini strokes, damage the brain tissue, and contribute to dementia. So we've had a generation or two, I guess we're close to 2 generations now, where there's 2 things, great amount of advancement with cardiology and cardiovascular disease treatment and prevention. And also the public has much greater awareness about this from the point of view of heart health. But what we point out in the book, what you do for your heart is equally important for what you do for the health of your brain. Next slide. So the good news is we have all kinds of evidence about how to keep the blood flowing. We don't have to know the biochemistry of the brain or where all the parts are of the brain. We just need to know these things on the left and right side of this slide. First of all, the main lifestyles to keep the blood flowing in the brain, same as the heart, are the miracle cure: physical activity, not smoking, maintaining a healthy weight, and the Mediterranean diet. There's overwhelming evidence about how these are extremely important. You don't have to take pills. You don't have to go to your doctor all the time. Just do these things. And then on the right side, there are 5 preventable and treatable health conditions that impede oxygen reaching your brain. And pretty well all the things on the left side prevent these 5 conditions on the right side: blood pressure, diabetes, cholesterol, atrial fibrillation, and many strokes. You can do a lot to minimize their occurring in your body. And then fortunately, all of these are treatable as well now. But even if you have been started on antihypertensive medication, you still should be physically active, not smoke, keep your weight at a healthy level, and use the Mediterranean diet. So this is the story about blood flow. Next slide. So moving on to the third area for brain health, and that's keep engaged and purposeful. So I wanted to stop again and give you a chance to think about that and write your thoughts about how you would recommend people keep engaged and purposeful in the chat box, and Joanne will monitor them. Thank you. With 192 people, we get a lot of responses. Okay, Joanne, did you want to comment on these?
Sure, lots of great responses coming in. So volunteer, I saw a lot, and continuing to work, helping others, taking a class, lifelong learning, hobbies, and a variety of those named, socializing, joining a group, mindfulness, and meditation.
Thank you. Could we have the next slide, please? So getting back to this threshold where early in our life, we increase our abilities, and then there's a point in our life when it starts to decrease. And so these are mental powers when they peak. So on the left, it's the age 18 and 19, information processing peaks, and then short-term memory at 25, and starts to decline a bit at 30 and 35. Emotional understanding peaks in middle and later adulthood. And probably the most interesting is crystallized intelligence, or accumulated knowledge and facts about the world, peaks in late life. So we all have to get the late life to really be wise and know how to live, I guess. Thank you. Next slide. So one of the things we have a very strong evidence about it with brain health and risk of dementia is that education is very important, and people who have especially early life education, the turning point for them to start to decline with their cognitive functioning is later than if they hadn't had education. Next slide. So we're back to this fitness gap issue with regards to all of these things we're talking about in terms of keeping the brain tissue healthy, maintaining blood flow, and also being purposeful and meaningful in our life. So all of these things close the fitness gap. Next slide. So hearing and vision, we didn't want to leave this out. Communication is more challenging if we don't have it. Hearing loss contributes to dementia, we know, and hearing aids need not be difficult to use. So this is very important to continue to be able to communicate, because we now know that through functional MRI that unlike if we were playing checkers, we might use one little piece of the brain. When we are talking to our friends and acquaintances, the whole brain is brought to bear. And we know that if you don't use it, you lose it in terms of the way the brain functions. It needs to have that stimulus to continue to develop networks and even generate new neurons in the brain. Next slide. So Ed is a role model for living later years independently in his home and guarding against loneliness and social isolation. He was 80, he focused on the aspects of life important to him, caring for his dog Charlie, taking newspapers and his garden produce to staff in the home where his wife Norma lived for 2 years. He had inner strength and compassion that enabled him to do that. He was well liked by his friends and neighbors because of his sense of humor, positive beliefs, and philosophical attitude. He had a can-do approach, which now we know, for example, with supercentenarians or people that live in that Japanese island, Okinawa, that's their life philosophy. Keep going. Ed was always curious, researched new seed companies, etc. Donated his garden produce, never a formal community leader, but he was participated in local events, and he was able to live alone, which testified as a thoughtful approach to life, suspicious phone calls, tradespeople around the house, and benefiting ability to communicate, work with them to satisfaction of all. So healthy wellness is what Ed was all about. Thank you. Next slide. So to summarize, keeping engaged and purposeful, keep your sight and hearing sharp, stay mentally alert by learning new hobbies, reading or solving crossword puzzles, staying involved socially, attending community activities, faith groups, and support groups, which many of you have listed when we had that 2-minute break for you to put it in the chat. Next slide. So the book goes in, I wasn't going to do this tonight, but the book goes into a fair amount of suggestions about what you can do and what your friends and family can do, and what's available in the community and in the health service for protecting your brain tissue, like getting more active and improving your physical fitness. Some of the things we recommend, of course, are belonging to well, in Ontario, we have the Bruce Trail, and that's a beautiful walking trail. And Saskatchewan, I know, has similar ones. Reducing the impact of stress, we mentioned walking in the woods as a way to reduce stress, sleeping better, keeping physically active during the day, etc., and being wary of over medication. So you can take on these things yourself, and it always helps to have your family and friends do these things with you. And we're fortunate in Canada, we have many many places in our community where we can learn more about this and also have support from different organizations. And then there's always the health service. Next slide. Similarly, of course, then with keeping the arteries open, these things at the top, physical activity, etc. These are all very, very important to keep our brain health. Some of these things we can do ourselves, some with our family helping. Like, for instance, it's very difficult to stop smoking if a spouse continues to smoke. Ways of finding out about how to get community support. For example, keeping your diet. It's really fantastic now that restaurants indicate the amount of calories in food, and helps you make decisions about your calorie intake. And then, of course, there's the health service, which is really important. On the right side, your family physician is instructed to take every patient's blood pressure when they come to the family practice, because it's often, it's a very challenging condition because there are no symptoms, but extremely important for your cardiovascular health. Type 2 diabetes, my colleague calls it physical activity deficiency syndrome, etc. Next slide. And then finally, what sources of support are there for people who want to keep engaged and purposeful, like keeping your sight and hearing sharp, staying mentally alert, and staying involved socially? You can get up and get on with these things. It's more fun, though, to do this with your friends and family. Like I said, in Canada, we're very fortunate. We have many opportunities throughout our communities to pursue any number of things. And we have a health service that's there to support us and encourage us, including many audiologists in many communities to help with our hearing testing and getting advice about how to deal with that. So next slide. So the key messages, one more time. I had this at the beginning of the slide, or this talk. First, this is the first book about this topic for professionals or the public, to summarize the medical evidence about dementia. There's lots in the scientific literature, but very little about how the public can understand this. We try to be as plain in our language as possible with this book. We wrote it and rewrote it many times to try to do that. Because negative ageist thinking reduces the motivation of people not to take action, or the book tries to summarize the evidence that the ability of the brain can be increased at any age. The rate of loss of brain function in normal aging has been overestimated. And physicians that have been trained a long time ago didn't know we didn't have the science then to tell them in medical school that they could expect the brain to benefit from being highly socially engaged, having great blood flow, and keeping the brain tissue healthy. The 3 steps, again, I just described, and then sources of support, what we can do, what our friends and family can do, and what's available in the community, and last but not least, the health service. And dementia is not the result of normal or accelerated aging. Only a proportion of dementia is caused by Alzheimer's disease. And so at any age, you can increase brainability, and at any age, you can reduce your risk of dementia. So next slide. So there's the book. It's available on Amazon if you want to pursue that. And we're also setting up a Facebook page that the Alzheimer's Society of Saskatchewan will have maybe when the recording of this talk is made available. And my co-authors and I are, Charles and Muir, are committed to making this information available through other media other than this book, through, like I said, Facebook, podcasts promoting and enabling physical activity, cognitive and emotional fitness, in the United Kingdom, the United States, and in Canada. And look forward, if you want to talk to us further about that, we'd be pleased to do that. So Joanne, that's all I wanted to say. It's 9:42. We said we'd have 20 minutes for discussion, so now it's 18.
Thank you so much, Larry. I see some of the questions are coming in. People are using the question and answer. That's actually an easier format for us. So for the next few minutes, if folks want to start entering their questions into the Q&A box at the bottom of your screen, and we will start to ask some of those questions to Dr. Chambers. So I'll invite you to start asking some of those questions.
The first question is melatonin, and it's there's a fair amount of controversy about that. I think I would check with my family physician, and you don't want to have any interactions with any drugs, and that's something you can buy in the other section of the drugstore without the pharmacist. So that's I don't think it's the same as using a prescription medication. So that's my answer. It's important to know vascular dementia or treatments the same. Well, there really aren't any. There aren't any treatments for Alzheimer's disease. With vascular dementia, as I mentioned, there are medications that are helpful.
Maybe I can read them out for you, Larry. Fish is important to our diet, but what supplement can a vegan take that gives a similar benefit to fish?
I don't know, but I'm a fan of micronutrients, and every day I have a salad and a variety of my food, because I don't think you can transform it into a pill in the health food section of the pharmacy. And again, I talked to my family physician if I had a vegan diet, so I'd be able to be aware if there are any risks of that kind of diet, given my health as an individual.
There's some questions about what is the Mediterranean diet. Do you want to expand on that a little bit?
Well, it's pretty well like I described. It is fruits and vegetables, not a lot of carbohydrates like bread and rice and things like that, unless it's whole wheat. And then it's all, the other thing, of course, it's everything in moderation. Fish and eggs and other things than meat are desirable. They seem to be important. And other things in the Mediterranean, of course, are olive oil as opposed to saturated fats. And it's really easy to find that diet. Just Google Mediterranean diet and it's on their website.
Excellent, thank you. Some people asking for some clarification about vascular dementia.
Well, vascular dementia is huge, and there's more and more evidence that all dementia has some vascular component, put it that way. We have new technology now to examine the brain, like I mentioned, functional MRI, magnetic resonance imaging, and that field is just moving extremely fast. And we have very large studies now of whole populations, not just the people that come into a memory clinic, where these, like I said, there's dementia throughout the community, and we're now learning more about that, and we're finding that vascular dementia is much more prevalent than we ever thought before. And the good news is, like I said, just like heart health, we can prevent vascular dementia and improve our brain health. Does that answer that?
Thank you. A question here. You talked about what you've been using over the last 7 years that has improved your sleep. And the question is, they wanted you to repeat that information or to expand on it.
Okay, well, I was actually at my dentist, and he said your throat is swollen, like it looks like you're having trouble breathing. Maybe you should go to your family doc and see if she will uh, send you to a sleep physician. So I did that, and the sleep physician said, well, it looks like, given your symptoms, the sleep physician asked about your sleep behavior, like whether you fall asleep during the day um, or you have trouble staying awake or whatever. Anyway, they have a very, very thorough way of assessing your sleep just by talking to you and getting the symptoms. And then if they're convinced that you have a problem, then they will send you to a sleep clinic, and you have a number of leads put on your body, and they monitor you with a camera all night, and you sleep there. And then at the end of the night, they accumulate all that information and send it to your sleep doctor. And the sleep doctor asks you to come back to her office, and she summarizes what they find. And if they feel that you would benefit from a continuous positive airway pressure device, where the device pumps air into your nose, so you don't have to work as hard all night. They may prescribe that. In Ontario, the government pays about $800 towards that device. Private insurance often pays the difference. They're about $1,000. And the third part of the process is you have to go to a store and buy the device. And these stores are separate. They're out in the community, and they're privately run. And they will help you with selecting the machine and finding out what things will make it comfortable for you when you're sleeping. Those are all the good things. And then you have to start using it. So there are two problems with using it, two big ones. One is that you look like Mad Max, and your wife and your family may really talk you out of it because they think you look crazy. And the second is there is a bit of discomfort for the first week or two in using it. And if you can get through that first week or two, when in my instance, as soon as they put it on me the second time, I did come back to the sleep clinic, and they tried it out. I missed a step there. They give it to you, and then they watch you another night with the device, using the device. And when I woke up in the morning, I swore I would never have another night without that device. I felt so good. So that's my experience. But then, like I said, the evidence about people who use these, unfortunately, the compliance isn't that good. It sometimes is as low as only 25% of the people use the device. But if you can use it, you'll benefit from it. And one final thing, my cardiologist was surprised. He thought it was only obese people that needed it. I'm not one of those people. I've benefited greatly from it. So that's my story.
Thanks, Larry. And people are just summarizing, sort of the abbreviation is the CPAP machine. People might be common with that. And then one of our staff just saying that the government of Saskatchewan does cover CPAP machines here. So, and then someone else has commented that, it's related, and people have probably heard the term sleep apnea as well.
That's right.
So another question here, and this is more about sort of the risks or the genetic risks of developing dementia. And, my mother had dementia, my father had Lewy body dementia. With these things being on both sides of the gene pool, is it a foregone conclusion that I will probably succumb to either one or the other? So if you want to talk a bit about the genetic risk.
Well, the good news about the genetic risk is it's very small. Not very many people in the population are going to get it because of their genes. And we talk about epigenetics now, and that's the combination of your environment plus your genetics. And like the talk demonstrated, there are many, we don't live in a very friendly environment for the kind of chronic diseases that we're talking about here, cardiovascular health, dementia, diabetes, et cetera. everything's the opposite. Like you graduate from high school and then you get a job and you drive your car to the workplace. Now you don't even drive to the workplace. You sit in front of your computer all day, and then you have supper, and then you watch TV all night. So you're totally sedentary. It's the worst thing you can do. So the other, I think the way to think about genetics and dementia, probably the best way is the early onset dementia is probably driven more by genetics. But again, the good news, it's in terms of the total number of people in the community that have dementia, you're only talking about less than 5% of that population of the whole community. So that's the story with genetics.
Great. A few questions here related to medication. So someone wondering, how would they go about reviewing their medications to see if there are any that are of concern?
Well, there's two ways. Probably the fastest and the best way, you might argue, is talk to your pharmacist. Pharmacists are basically, let's face it, underutilized in our community. They have a lot of knowledge. And of course, they won't stop with just the prescribed medications. They'll also ask you about your over-the-counter medications. And they are trained specially, arguably as much or more than physicians, to know about the side effects of drugs and problems with combining drugs. So that's the place to go. I wouldn't trust the internet. I wouldn't, this is all very individualized. So the pharmacist, if you talk to a pharmacist, they talk about their patients, like they consider us their patients, and they see us all the time, and we keep going back to the same pharmacy and seeing the same pharmacist. That's all good news, because you get continuity care, and they understand you, and they can help you a lot.
Thank you. So a question here, just some more clarification about hearing loss. I assume that loss of hearing contributing to dementia is because of the lack of auditory stimulation. Can you expand on that?
I don't think it's auditory stimulation as much as communication. Being able to communicate with other people. Like I said, we now know that social interaction is extremely important to keep your brain active. It requires all parts of your brain to be on full speed. And we didn't really understand that before until, if you watch a functional MRI is through time. So you can see when someone is, I watched a functional MRI with a person using a simulated driving wheel, and they were driving down the road, and they had to make a left turn and make decisions about whether it was safe to turn, and the whole brain, the blood flow increased throughout the whole brain to make that decision. So when you're in a social situation, you're trying to keep up with the conversation, etc. So that's what sight and hearing. If there's barriers for that, then your communication may be compromised, and that's probably the important thing about brain health, communication.
I'm just going to read you a comment. We have a doctor of audiology from Regina that's part of the presentation. Thank you for highlighting the importance of correcting hearing loss. It is the highest modifiable risk factor. Your book will be available to borrow from my clinic. Thank you for the great information. And then she also commented in the chat, yes, auditory stimulation and auditory processing, but socialization is very important too.
Okay.
A question as well. So this one's related to exercise, which you called the miracle cure. So could you provide some examples of the 3 areas of exercise you mentioned: flexibility, strength, and endurance?
I don't know, can Deneen put that slide back up? Deneen, are you still there? Yeah.
Oh, she's popping that up for us.
There it is. Okay. It's farther down. Farther down. Farther. There it is. There it is. Number 23. So the 3 types are Oh, we lost it. 23. So the three types are flexibility, strength, and endurance. So flexibility, like 4 to 7 times a week. The benefits are gentle reaching, bending, stretching, keeping your muscles relaxed and joints mobile. And sample exercises are stretching, dancing, yoga, martial arts, other activities that involve bending and stretching. And then strength activities is equally important. 2 to 4 days per week, strengthens muscles and bones and improves posture. Lifting weights, carrying supplies, climbing stairs, moving furniture. I always volunteer to do everything around our house, so I can keep going on that one. A lot of these things you can do, just with daily living. You just have to get up and go. And then endurance activities. How much? 4 to 7 times a week. Benefits, improves your heart, lung, and circulatory systems, and active commuting, active transportation is the other way to say that, brisk walking, cycling, jogging, swimming, racket sports, skating, etc. On my Apple phone, I have the number of steps a day. The American Heart Association recommends 10,000 steps. And some days I have trouble getting up there. It's really frustrating, but today I feel really good. I've got 16,000 steps because I was cycling. So there they are. I hope that answers the question. Are we stopping at the hour?
Yes, so we've only got about 2 minutes left. So I'll maybe just do one more question, and then we will sign off for the evening. So this question is talking about THC and CBD oil, and does that have any bad effects on the brain?
Don't know. I don't know. That's a tough question. I don't know.
I know certainly that's an emerging area of research, and so we'll have to stay tuned and see what research has to let us know about that in the future.
I have never come across that, so that's very interesting.
So thank you very much for facilitating our Healthy Brain presentation. And I want to thank everyone who took the time to join us this evening and to participate in the chat session and by asking questions. And I do hope that this evening's presentation will inspire you to learn more about your brain health and to take action on some of the strategies proposed by Dr. Chambers. So following tonight's presentation, we will be sending out a survey, and then within that survey, we can include the link to the Facebook page that Dr. Chambers was talking about. So thank you again, Dr. Chambers, and thank you to everyone for attending this evening's presentation. Have a good night.